Okay, we are going to go ahead and get started. Hello, everyone. Welcome to tonight's presentation on rural health outcomes in Nebraska. My name is Kristen, and I'm an AmeriCorps member serving with Conservation Nebraska's Common Ground program. Conservation Nebraska's mission is to protect our state's natural legacy by educating the public, supporting communities, and increasing civic engagement, which we accomplish through locally led education efforts and community engagement projects to address local conservation concerns. Before tonight's speaker, there are a few rules to go over. Your cameras will remain off and you will be muted throughout the presentation. Please type any questions that you have in the chat or in the Q&A section, and we will answer those at some point during or after the presentation. Following the presentation, we will have a very brief survey that should only take less than a minute to complete. This survey helps support programming like this one, so we appreciate you taking the time to fill it out. Tonight we welcome Hannah, so I will just go ahead and let her take it away.
Sounds good. Thank you so much. And just wanted to make sure everyone can hear me okay. I think you should be able to. But we're going to go ahead and dive on in tonight. I am so excited to be here and just be talking to you guys all about rural health. So one thing, just to kind of start off and set the stage, we're going to begin tonight with just giving you guys kind of an introduction to myself. And I promise I'm not being a narcissist here. I really do kind of have to tell you my story in order to kind of set the stage for this presentation. But what we'll do is we'll start there, and then we'll really just kind of dive into what we're seeing in terms of rural health outcomes across Nebraska. And, honestly, the information that we're going to cover today is a little daunting, to be completely honest with you. It's just kind of the nature of the beast in terms of our rural communities. But then what I would like to do is really spend the second half of the presentation talking to you about how we are addressing these outcomes head on with some initiatives, some collaboration, and some partnership. And then I think at the very end, just kind of, I'm hopeful that we'll have time for questions, comments, just so that we can kind of brainstorm and continue the conversation from there. So let's dive right on in. As mentioned, my name is Hannah Guenther, and I am a Rural Health Extension Educator with Nebraska Extension. And I am reporting live from my home. I work remote 95% of the time. And my office is located in our home, and our home is located smack dab in the middle of a 5,000 head feedlot. And it's important to kind of tell you this. So I did not grow up in an ag or rural background whatsoever. I actually was born in St. Louis. I grew up in Dallas, Texas, and I actually moved to Oakland, Nebraska when I was in high school. And again, still very would not classify myself as rural, even though obviously lived in a small town. And it wasn't until I met my husband Adam that I really began to kind of learn more about the ag industry. My husband, he manages the feedlot, and this is his family's operation. It's been in the family for over 100 years. His mom, he grew up in this house. His mom grew up in this house. His grandpa grew up in this house. And so just a lot of history and legacy there. But you know, I love to tell the story just to kind of share how wet I was behind the ears. The first time I came out to the feedlot, I rode around with his dad, and I was like, wow, you guys have a lot of cows. And if you know anything about, again, the cattle industry or feedlots, we don't have cows. We actually feed a lot of steers and heifers. So I really got a quick learning experience right then and there. But really, it shed so much light to me on rural and ag, which I'll kind of touch on a little bit more. But prior to becoming working in extension, I actually was a family consumer science teacher and really enjoyed my time in the classroom, but was so thankful to have the opportunity to kind of expand my reach in terms of my audience and not be confined just to 7th through 12th graders, but really be able to reach adult audiences as well. So prior to this position, I was a food nutrition and health educator. And my goal truly was just to, again, educate on all things food, nutrition, and health in my 3 counties, which are Cumming, Stanton, and Colfax County. And I enjoyed it so, so much. But during this time, I really began to realize that it is one thing to focus on nutrition, but really health is so much bigger than that. And there are so many different aspects, including environmental factors, including, economic factors that go into affecting our health and our wellness. So, that really led me down this rabbit hole of kind of filling in the gaps of my education and really kind of paying attention to like what was the need in my community and how could I again fill those educational gaps for myself, but then for others. So this began kind of a passion project for me, focusing on rural. And really what I did was realize that there really wasn't any nutrition education programs out there that focused on this rural audience. For those of you who live in a rural area, this will make sense to you. But for me, we feel so lucky being in West Point. We actually have two grocery stores. And that's a big deal when you look at the food deserts that are located across our state. But for most individuals, they would learn about nutrition and they were like, I don't have these ingredients in my small town grocery store. Like, and if I want a healthy food choice, sometimes my closest option is a Casey's gas station. So I really began to think about, okay, how can I take nutrition education but really put that lens of rural? And so I focused on that for a really long time and was such fulfilling work. But I realized again that nutrition was only really one piece of the puzzle there. So as I mentioned, I began kind of looking at like my own personal education. What was I going to do? How was I going to kind of again best serve my audience? And that actually led me to go back to school. So right now I'm currently working on my Master's of Public Health through UC Berkeley, and I'm a part of their Rural Health Innovation program, which is pretty amazing because it really is focused entirely on rural. So it has just been such an eye-opening program and really prepared me for this next position, the position I'm currently in, which is a rural health educator in Nebraska Extension. So now my job does look a little different. What I do is again, my title is or my charge is truly just to improve the health of our rural communities. So what I would like to do, I know that's a lot about me, but I really hope it kind of sets the stage. And I feel like I almost have to kind of explain where I was, where I've been, because, again, talking about these rural health outcomes, it really is it's a personal topic for me. It's a professional topic for me. And really it kind of is this like full circle moment. So thank you for humoring me by listening to my whole story. But what we're going to do now is I would love to spend some time looking at the critical issues, um, focusing on rural health in Nebraska. And really what I've done is I've kind of broken this down into three main issues. And then again, what we're going to do at the tail end of this is really focus on what we're working on to address these outcomes or these issues head on. So number one, first and foremost, we have seen that rural Americans are at a greater risk of dying from heart disease, cancer, unintentional injuries, chronic lower respiratory disease, and stroke. Now, again, there's no one reason why this is happening. There's a lot of different reasons, and there's a lot of speculation on why this is happening. Again, some of those being environmental exposures, being in the being related and tied so closely to the ag industry. Also, there is we're going to focus on this. I'll talk about this in a little bit, but again, just the lack of healthcare access. But then there are, again, just other factors tied to that. So let's look at the data though and really dive into what this looks like. So obviously here you can see here is our prevalence of obesity in Nebraska in 2021. And again, you can see here, honestly, across the state, this really is, we're seeing very high rates of obesity across the state. And this is really directly linked to certain cancers as well. Here you can see this is the rate of deaths of cancer in Nebraska. So on this lower line here, you can see this is our metropolitan area. So you can see it's quite low compared to our non-metropolitan areas. And here is the cancer incidence rate across Nebraska. So again, you can kind of see, we do see some kind of interesting, I just think this map is so interesting. And one thing I think is interesting about this, and we'll talk about this a little bit more, is you will notice on some of these maps, these little hot spots of these kind of where we're seeing cancer rates, which I just think is so fascinating. Here you can see this is prostate cancer incidence rates. This data is actually from a new software that UNMC created called InFocus. And it is amazing. This interactive map, you can kind of type in different, different kind of cancers that you want to look at, different sorts of social demographic information, and it'll create the map for you and generate the map for you in real time. But just a fabulous resource. So I just kind of just picked two, but here you can see prostate cancer again. Again, these kind of interesting little hotspot areas that we're seeing. We also see a very much a higher rate of death from unintentional injury. Now, again, this is again kind of aligns again with being in ag related communities. We can see higher rates of, automobile accidents and farm accidents as well. And then, yeah, so that's issue number one. So again, I promise you guys, I'm not going to be a Debbie Downer in this presentation. I know this is all heavy. Like I literally hate how I'm like, oh, this like hurts my head seeing all this because I'm like, wow. But I promise we're going to talk about how we're going to address it. Okay. So the next critical issue that we see is healthcare and healthy food access. So as I've mentioned, if you guys reside in a rural community or if you've driven through Western Nebraska, you've seen this firsthand where just again, a lot of times you are very far away from the nearest hospital or the nearest grocery store. So here's an example, mental health professional shortages in Nebraska counties. Pretty terrifying when you see this. I just think this is a really heavy slide, but it is the reality of what we're dealing with in our rural communities. Here you can see this is the comparison of healthy food. Metro on the top, or rural on the bottom there. So this again, just low access to healthy food in our counties. And one thing that I think is interesting here is if you kind of read this note, they say that urban areas living 1 mile away from a grocery store, rural areas 10 miles from the nearest grocery store. And, I've shared this information before with other groups and people are like, 10 miles, I wish. That is actually pretty close. And, that is really the reality for so many is we're looking at, 25, 30 miles from the nearest supermarket. So just something to take note of there. Here you can see this is a map of our Nebraska food deserts. So again, kind of pocketed throughout the state here, but you can see that's kind of where we're at in terms of food access and healthcare access across our state. Now, next, another huge barrier that we are seeing or critical issue is barriers. We actually had a meeting today, and I'll talk about a little bit about this later. And those barriers are all around healthcare literacy, stigma, and trust. So healthcare literacy, again, in our rural communities, there is kind of a lack of that translational data. So again, they're going to the doctor, they're getting feedback from their provider, but they really are not understanding what that means. And the other part of that is, being in a rural community myself, we're seeing so many closures and retirements of our healthcare providers. So maybe you did have a provider who, again, you had that relationship with, you had that ability to kind of communicate with, all of a sudden they're gone. And you're having to rebuild that relationship with a new provider. Stigma, again, in rural communities, there is that sense of, tough it out. There's that tough it out mentality where we don't want to go to the doctor. And especially given insurance and cost right now, people, especially in rural communities with rural copays, it's one of those things you're going to go to the doctor. You really don't know how much it's going to cost. And so that's leading a lot. This kind of builds into the trust too, but it's definitely causing people to second guess, seeking medical attention and trust too. In the public health world, we talk about the pandemic quite a bit and just how for many that really was a break of trust in terms of the healthcare system. So on the flip side of that, how can we rebuild this trust in our healthcare system so that people are, again, taking care of their health and improving these health outcomes long term? So I know that was a lot. I know that was heavy. That's kind of the state of where we're at in terms of rural health outcomes. But I'd love to spend the rest of the time really just focusing on what we're doing to address these head on. So as I mentioned before, this has been such a unique opportunity in my position. Hopefully you guys are familiar with working with Extension, but Extension, we have a presence in all 93 counties across the state. And we have regional experts in all 8 kind of arms of our system, which includes food, nutrition, and health, ag profitability, livestock systems, 4-H, horticulture, water and cropping systems, rural prosperity, Nebraska, early childhood. I think that's all of them. And we really do have this strong local connection. And so one thing we've been working at is how can we leverage this local connection, this trust in our community with the resources and the research that's happening at UNMC and at the Cancer Center. So one of those is, again, we're looking at programs that we already have. So Food in the Field, as mentioned, was a program that I created, again, focused on helping farmers and their families make healthy eating choices. But really what we've done is we're pulling in UNMC to help them kind of lift this up and use this as a program to really address chronic disease prevention, obesity reduction, and food resource management. So as I mentioned, this program really is focused and highlights, again, every recipe is all like things you can get at your local grocery store, your local small town grocery store. So again, in using this kind of as like a springboard to help UNMC speak rural, that's one thing we've talked about a lot, is just kind of like how can they speak the language of their rural constituents. So really exciting things happening here. Another thing that we're working on is a targeted cancer prevention program called Prevention Plates. So this we just created, and it's based on the American Institute of Cancer Research's diet recommendations. And again, it's all about taking this information and making it bite-sized, pun intended, so that it's palatable, another pun intended, but making it so it really is, people can take that information and apply it right then and there. As you kind of saw, we have really high rates of cancer across our state. So the biggest thing is, ideally, we would prevent it at the very beginning. Now, there are only so many things in our control, but diet, exercise, alcohol consumption, smoking, all of those things are in our control. So that is one thing that we really are working, is how can we kind of build this autonomy and this empowerment in our rural communities, that you actually do have the ability to eat in a way that can reduce your cancer risk. Obviously, nothing is completely preventable, but there is an opportunity to work in that prevention space. Next, we are really, really focused on screening. So I was talking to someone else about this, and as I kind of showed you, those maps are so interesting about cancer. And again, how we're seeing these little pockets of cancer popping up here and there. And if I wish I had the time to kind of show you guys all of the cancer, but I can even put at the end of this, I can put the link in the chat so you guys can play around with that website. But every cancer is different. It really doesn't follow like a steady trend at all. It's so unique. So one thing, I think the goal would be ultimately that research is being done and that we could figure out, pinpoint the cause of that. Is it an environmental exposure? Is it, water quality? Is it nitrates? We're 30 years from knowing that answer. So what can we do right now? And that is, we can increase cancer screening rates so that we can improve survivorship. So this has been a huge effort that we're working on with the Buffett Cancer Center. And one thing that's really cool that we're doing is, in so many of these rural communities, it's like, okay, I know I need to get screened, but I don't really know when. And gosh, like I'm taking time out of my day. I don't have time to make all these appointments. So what we're doing is we're actually creating a all-day cancer screening event. So UNMC is coming in, they're helping us kind of do the heavy lifting, but this is completely in partnership with our rural local hospitals. And so they're providing the manpower, they're providing some of the equipment, but UNMC is kind of taking care of the charge. They're working with insurance, And what they're doing is you register for this screening day. If you are not, if you do not have insurance, they will sign you up for Medicaid ahead of time. And that way you can come in and you can get screened for every possible screening that is available that day. So a skin check, a low dose CT for lung cancer, um, prostate exam, and a colorectal fit kit. So all of those would be taking place in one day. And the other thing is that's amazing with this. Again, I was just in a meeting today and we talked about how screening is great. Screening is wonderful. And again, it does improve your survivor rates if you catch it early enough. But if you don't follow up, if they say, okay, that mole, I want to come back and we want to see that. If you don't follow up, it's all for nothing, right? So it is so important that we're kind of building in that piece of how can we kind of identify these community navigators, or how can we utilize community health workers to follow up with these individuals? Hey, how's it going? Did you make your follow-up appointment? Like, can I help you do that? Would you like me to go with you? Again, breaking down those barriers and really kind of, again, making healthcare accessible and trustworthy. So we're really excited about this. We're actually hosting one of these events in West Point in July, and the goal would be that we would roll this out across the state. Again, just to get people into that habit, get people back connected to their local hospitals, so that again, screening kind of really does become just a part of taking care of themselves. Another thing that's happening that we're working with, again, rebuilding this trust piece. UNMC and the Cancer Center has said, it's really easy for them to kind of get stuck behind the lab desk. They're working on research, they're actively pursuing new research opportunities, but for them, it is all about that rural connection. So what we're doing right now is we are working on a toolkit that actually is done. Talking a lot. I gotta hydrate. This is actually done and being rolled out again this month, or actually next month, and it's all about Let's Chat Cancer. So what they're doing is they are contacting local communities, identifying a key issue. So in April, I cannot remember the community that they're going to, but it is all about nitrates. And what they're doing is they are bringing researchers from the Cancer Center, and truly it is like a town hall style event where community members can bring their questions. They can ask, learn about what research is happening, learn about, should I be involved in this research, and just learn more about, again, these key issues in their community. Because again, as mentioned, UNMC, the Cancer Center, everyone is really wanting to hone in on these issues and these specific cancers that are popping up in these like cluster areas. So really excited about this as well. And hopefully, again, we'll just again start that conversation as well. As mentioned, and as you guys saw about unintentional injury, a huge issue across our rural communities. And I cannot say that obviously it is caused by sleep deprivation, but I don't think it helps. So one of the things that I do in my job, one of my buckets that I spend a lot of time in is sleep. So 1 in 4 Nebraskans is actually not getting the recommended amount of sleep every single night. So and just like a quick, obviously there's a couple of you guys on the Zoom today, and the recommended amount of sleep is 7 hours every single night. So I'm not going to kind of do my normal show of hands, but even from that room, probably not everyone is getting that recommended amount. And in an ag driven economy where ag is you're putting in 18 to 20-hour days, and then operating this equipment, you can see how unintentional injuries and accidents are very, very prominent. So one thing that we are really working on is educating on the importance of sleep as a part of taking care of your overall health and your safety. So Sleepless in Nebraska is our program that we run, and we have, and we teach it in a bunch of different audiences, and we have a couple different kind of groups that we kind of focus on. One is though our ag producers, and this really is focused on during those busy seasons of harvest and planting, prioritizing sleep, because we have a comparison, a chart in our presentation that looks at driving under the influence of alcohol and comparing it to lack of hours of sleep. And we see a comparison between the two. So it really is so important in such an easy way to really kind of, again, reduce that amount of unintentional injury just by, again, prioritizing sleep and not operating equipment or even getting behind the wheel of a vehicle if we are running on minimal sleep. I could talk about sleep all day long. So another thing, as mentioned, nitrates is a super hot topic in our extension work and especially in our rural work. So one thing that we are doing right now, focused on breaking down the barriers and, like, as I mentioned, to improve trust and build health literacy. Our extension team, we actually are hosting a program next week. Focus, and it's called Know Your Nitrates, and individuals can come in, they can bring a water sample, get it tested right then and there, get information from their local NRD, with just, okay, what do I do next? I tested my water, what do I do now? And so again, and really what we're hoping is this is just that face-to-face connection of, okay, nitrates is kind of a buzzword. You don't have the time to do, all this information, but we have experts in extension. So lean on us, and here we can provide unbiased research-based information. So really looking forward to this. Know Your Nitrates is our first one, and we are hoping to have multiple of these. So we would love to have one on pesticide exposure as well, especially female pesticide exposure, and that secondary exposure. So you're not, for example, for me, I'm not applying the pesticides, but my husband is. So what do I need to know in order to, keep our home safe and reduce slash eliminate that secondary exposure? So we're really looking forward to this. And again, just another one of those environmental exposures that's very important in our state right now. As mentioned, here we go. I forgot I put this slide in here, but I am going to use this actually for actually, I didn't have time to change this slide before another meeting, but we are working on, again, we're looking at pesticide exposure in women. Another area though that we are looking at specific to women is cervical screening rates. And so we actually are talking right now, we're having a conversation about just what is the current climate in terms of cervical cancer screenings, and the HPV vaccine. So we're working on some information about that, and hopefully, it will kind of drive us to just, again, gather more information, produce more educational materials. Again, just kind of building out that trust and that health literacy as well. So hopefully this was eye-opening to you, and shed a little light on, again, not only the rural health outcomes in Nebraska, but also what we're doing to address those head on. And I should say, kind of disclaimer too, this is really just the projects that I myself am working on in collaboration with these different entities. There is so much work being done, and I don't want to discredit that whatsoever. Really, all I did was kind of just share with you what is on my desk currently, to kind of, again, foster, and again, and build this self-efficacy and health promoting behaviors. And, I love this kind of this slide, this last slide, because I really do feel like it kind of encapsulates like my goal and what I'm hopeful for in the future. But if you aren't familiar with public health, or you're kind of like, well, like my public health department, that's part of it for sure. But public health really is this combination of prevention and promotion. And I truly believe that is the best way to impact these health outcomes across our state. So prevention, obviously, the goal would be that we have these behaviors so that, again, we're reducing our risk from the start. But how can we promote these, again, these life-saving practices such as screening, etc.? So ultimately, my goal, I'm so hopeful that, the work that we're doing will, again, improve the lives of rural Nebraskans. And every day is a challenge in my job, but it really does feel like such fulfilling work. So that is my presentation for today. Hopefully it was insightful. I can see that there's 2 questions in the chat. So I'm going to go ahead and unshare my screen. I also wanted to just leave this here. This is my email address. If you guys have any questions, you want to learn more about any of the programs that I shared, or if there are any collaborative efforts, partnerships you want to work together again to address rural health, please reach out. That's a lot of my job too, is just making connections with people. And whether it's me, whether it's someone else within our organization, I would love to connect with you. So I'm going to quick see. Oh, okay. Yes. And Kristen, I can go ahead and just read our these questions if you want me to.
Yeah, that works for me.
Okay, perfect. So the first question I see is, how can someone help advocate specifically for more healthy food choices in their community, new stores and more food access? Are there any groups you can recommend or places to get started? Wow, what a phenomenal question. So my thought is, one of the things that's happened in extension is we developed, actually Iowa State has a program, and it's all about like establishing a food, gosh, I'm gonna have to pull it up on my other screen and try to find this for you because it's gonna drive me nuts if I can't. It is an Iowa State Food Sovereignty Food Council, and that's an amazing place to start. And this is a community food systems program. I'm gonna go ahead and put this in the chat for you. And this is a fabulous way to start this, in my opinion, because what it does is it gets everyone at the table. So it brings in producers, it brings in nutrition, education, it brings in the consumer, did I already say consumer, producer, everyone. And that is a phenomenal place to start, because when you have someone from every different sector of the food system sitting at the table, that's when you can really get the ball rolling. So I don't know where you're located or what your community looks like, but maybe something to look at is kind of establishing, again, that kind of local food system. And gosh, what do they call them? They call it's something catchy, and I can't remember what it is. And I was a part of it. This is gonna drive me nuts. But I'm sure if you go on their website, you can kind of see what it's called. But that is a wonderful, a wonderful place to start. Okay, the next question I have, where do I find an extension office? I love this question. So I'm going ahead and put in the chat, but you can go to epd.unl.edu, and that is our extension directory. And if you go on that website, I'll go ahead and put it in. I answered the question, but I'm going to go ahead and put it here too. If you click on that, you can see that this is going to honestly bookmark this page. This is a wonderful place to start if you are looking for, again, your local community connection, but also if you have a specific topic. So again, if you're looking for, I want healthy food, you can type that in, and if you will see that food access and health equity are some of the things that come up, and that would be a wonderful place to start. So I will say our website is under construction. Like what website is not under construction right now? So if you get to a broken link, email someone. Just again, find someone, email them. One thing in extension I will say, even if you get to the wrong person, we will get you to the right person. So that is a great way to connect with your local extension office as well. Oh, this is a great little survey. Perfect.
Well, thank you so much, Hannah.
Yes,
Really appreciate it. It was very good information.
good, 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 good. Well, hopefully it was helpful. Hopefully it wasn't too, it's a heavy topic. But I'm so hopeful because so many people are so passionate about this that I really am excited to see what happens, in 5 to 10 years. So.